Hey, good morning and welcome to the UroPatient podcast. I'm your host, Vic Sinise. We've got a great show for you today. If you're watching us live on any of these particular places, we come to you in all those places live, 10:30 every Saturday, Central Time. Also, check out our website at UroPatient.com. Best place to find all of our past episodes and these helpful handouts. Be sure to check out all those handouts. Yep, that's at UroPatient.com. So today we're going to be talking about what is testicular cancer. Kind of, as I said, this is our Men's Health Month with Movember, the mustache, as we talked about last time. So now we're going to talk about testicular cancer. So as we might think, testicular cancer starts in the testicles. And though it's rare compared to other cancer, it does predominantly affect the younger men, typically men between the ages of 15 to 35. Now, that's bad because we hate to see cancer in young people. We hate to see cancer, period. But the good news is that it's one of the most treatable forms of cancer with high success rates with early diagnosis. So testicular cancer, again, probably the most treatable form of cancer that we know, has super high survival rates detected early. The overall prognosis is excellent. But here's kind of an overview of survival based on the different stages. Now, we know that cancers can come in different stages. Stage 1 is localized. That means that the cancer is confined to the testicle. We don't see it anywhere else except in the testicle itself. Now, that usually accounts for most of these. And the 5-year survival rate is about 99%. So, like I said, these are those of us that work in cancer, know these are crazy good numbers to find. Now, stage 2 cancer, which is we call regional. So when it starts in an organ like the testicle, it can spread locally. The first place it typically goes is to the local tissues and the lymph nodes, most importantly, right around that area. But still, the 5-year survival rate, even at stage 2 cancer, is 96 to 98%. Crazy good numbers. That's great. And distant, which is what we really worry about, that's the late cancers, stage 3, even if the cancer is spread to distant organs and it likes to go to things like the liver, the lungs, and the brains, the 5-year survival rate is still 73 to 80%. And again, fantastic numbers, survival from this. So thanks to advanced treatment methods such as chemotherapy, survival is still favorable even after this late stage. Now, this is a picture here of Lance Armstrong, a renowned cyclist. He was diagnosed with testicular cancer in 1996 at the young age of 25. Now, his case was highly advanced cancer. He had probably ignored the large mass that was forming in his testicles. But what happened is he started to develop the signs of metastatic disease. So when he was diagnosed, he had stage 3. Remember, that spread to other organs. And it already had spread beyond his testicles to his abdomen, his lung, and his brains. So metastatic cancer, in most cancers, that's kind of time to start looking into hospice. But remember, this is testicle cancer. So his initial symptoms were testicle pain, swelling, and other signs like coughing up blood because of the mets that he had to his lungs. And that's what really got him in to be investigated. So he underwent the standard treatment, which was to remove the testicle. Obviously, that's where they start. And then he also received chemotherapy. That's the key. In testicle cancer, these cancers are very chemosensitive. And because of it being an athlete, the normal routine that we put people on, the normal chemos, are more toxic to the lungs. So he had actually went and saw a specialist, a guy from Indiana named Dr. Lawrence Einhorn, who had opted for a different cycle of chemotherapy that avoided this lung toxic type so that he could get back into his cycling once he was treated. So he did have his chemotherapy. He also had, as I said, brain mets, and they actually went in and did surgery to remove those tumors in his brain. All this responded. And despite his advanced cancer, Armstrong made a full recovery with the chemotherapy and surgeries and even returned to competitive biking. He won I know there's some controversy about blood doping and stuff, but he did still win the Tour de France 7 times. His greatest accomplishment, I think, has been the increased knowledge of testicle cancer. So following his long battle, he started this foundation, originally called the Lance Armstrong Foundation. Now it's called Livestrong, to support cancer survivors and raise awareness. And this story inspired millions, particularly because of his victory over such an aggressive cancer and subsequent athletic achievements. So what are the risk factors? Well, there's several factors that can increase the risk of developing testicular cancer. These include having a family history of the disease, being born with an undescended testicle, and race, with Caucasian men actually at the highest risk. Additionally, men who have had testicular cancer in one testicle are at higher risk of developing it in the opposite testicle. So what about this undescended testicle? What is that? So as we see here in the picture, the undescended testicle is a condition where one or both of the men's male testicles fail to move down into the scrotum before birth. Now, normally during fetal development, the testicles form in the abdomen and descend into the scrotum before birth. In boys with undescended testicles, this descent doesn't happen, so that doesn't drop down. The reason the testicles drop down out of the abdomen and into the scrotum is to lower the temperature, and it's key for sperm production. At high temperature, the sperm is not produced as well as it does by the 1 or 2 degree cooler temperature that the scrotum provides. Also, this is the important thing, in an undescended testicle, the temperature, again, being higher, they think that over time, this can lead to abnormal cell growth and potentially cancer. So undescended testicles, a high risk of having a cancer. Not all undescended testicles will become cancerous. The other problem is when they're down in the scrotum, you can feel them to see if there's any lumps or nodules, but you can't do that when they're up in the abdomen. So most of these are pulled down surgically as children to fix that. So what are the signs and symptoms? Most common sign is a lump or swelling in the testicle. Now, not all swelling is cancer, so it should get you in to get checked, but it's not always cancer. Men also experience pain or discomfort, a sense of heaviness in the scrotum, or a dull ache in the abdomen or groin. In some cases, the fluid may suddenly build up in the scrotum. Recognizing these early symptoms is critical for early diagnosis. Now, the simplest thing that you can do is what we call regular testicular self-examinations. They're a key to early detection. Men should perform these just like women do breast exams. Men should do these at least once a month to check for any unusual lumps or changes. Especially these are young guys that we need to have checking. If any abnormalities are found, you should go to your doctor, who will perform an ultrasound, may conduct some blood tests, but the ultrasound is the best thing for looking at whether this is an abnormality of the testicle or something outside of the testicle. Now, biopsies, we do biopsies to check for tumors, are rarely done in testicular cancer because of the concern that it could seed the tumor to go other places. So typically, if the high index of suspicion is cancer, they will remove the testicles surgically to remove it and diagnose it. So here's a little chart about how easy it is to do a testicular self-exam. You just want to kind of, as you see in that figure there, cup the testicle between the fingers and kind of roll it between your hands and feel for any lumps or bumps on the actual testicle itself. Now, as you see in number 3, there is a cord that comes down that you can sometimes feel. We're not worried about that cord so much. It's going to feel like a little, almost like worms, we sometimes say. But the consistency of the testicle should be very smooth and both should feel the same. Now, sometimes one testicle might be slightly bigger than the other. That's perfectly normal. But if you feel like something, a lump or a bump, like a P-shaped thing inside there, that's when you need to get in to have it checked. And treatment for testicular cancer normally starts with surgery. As I said, you have to remove the unaffected the affected testicle to find out what it is and if it's cancer, what type of cancer it is, because different types of cancers form in the testicles. We call them seminomas and non-seminoma. The difference for that is, in our particular case, is seminoma is the one that's very sensitive to the radiation. So if you have a seminoma, you're going to have radiation therapy. If you don't, you're going to have chemotherapy. Some cases of seminomas actually have some chemotherapy also. Sometimes we can actually watch, remove the testicle and just do what we call active surveillance. Because of our imaging studies being so much better now, we can watch for those lymph nodes to see if there's any sign of recurrence. Again, it's changed so much, and the cure rate is so high. So the prognosis for testicular cancer is very positive, with a survival rate of over 95% if detected early. Most men go on to live normal, healthy lives after treatment, but regular follow-up care is essential to ensure the cancer does not return or spread. And that's key. One of the big difficulties in this particular disease is we're dealing with young guys, and they get treated, they think they're in the clear, and they fail to follow up despite us even sending letters, hey, you should come back. We don't know. People may have moved. What's happened? And I can tell you, I remember one case of a young guy in our practice who just did that, never came back for follow up, and we later found out that he had actually died of his disease because it had spread so bad. So don't think you're off the hook because it's a highly curable. You have to follow up. Raising awareness, again, is crucial. That's why we're doing this during this Movember. Young men don't think about the risk of cancer, but testicular cancer is something that can affect them. Encouraging regular self-exam and early medical consultation if something feels off can save lives. So I hope you enjoyed today's show. Again, we're going to keep up with these Movember subjects on men's health. I think it's really a great time to focus on that. And keep tuning in to the UroPatient podcast, and we'll see everybody next week on the UroPatient podcast.